Welcome to the Skin of Color Savvy, the art and science of treating patients of color, the official podcast of the Skin of Color Society, hosted by SOCS leaders and produced by HCPLive. I'm Dr. Morayo Adisa, and I'm pleased to be joining you for this Savvy Conversation episode focused on a rapidly evolving and increasingly important topic in dermatology, tech check. AI Telederm, and the bias question. I'm joined today by my colleague, Dr. Roxana Daneshjou, whose work has been at the forefront of evaluating artificial intelligence in dermatology and also understanding its implications for equitable care. Dr. Daneshjou, would you introduce yourself to the audience? Thank you for being here today.
Hi, thank you for having me. I'm very excited to be here with you. I am a dermatologist, board certified dermatologist. I practice clinical care half a day a week, and the rest of the time, I run a research lab at Stanford University, focused on AI in healthcare. And one thing that we really like to spend a lot of time on is how you evaluate AI. And in particular, we've been really interested on how you evaluate whether AI is behaving equitably. And we have done this across both studies that have looked at imaging-based AI system and large language models. And it's probably not a surprise to you to hear that unfortunately, um, in many cases, AI reifies existing structural racism that exists in the healthcare system.
Thank you very much. Very, very interesting. It's what are you mentioned that it's not surprising that AI actually mirrors some of the structural racism in medicine. What are some of the examples? Do you have some examples or do you have some illustration to help our audience?
Yeah, I have, there are unfortunately so many examples. I'm going to pull from examples not only from my work, but also the work of others. Um, For example, Dr. Ziad Obermeyer published a paper in Science that is very well known, looking at systems that helped hospitals decide who gets additional support post-discharge to try to sort of make sure that people don't get readmitted. And it was actually a system that was already deployed in many hospital systems. And he got very fortuitously, he was able to get access to test the system. And what he found is that the system was allocating resources to white patients. Um, so if you took a white patient and a black patient that received like some amount of resource, the black patients were always much sicker than the white patient. So there was this huge divide, and the reason for that divide is that Dr. Obermeyer found that the algorithm was using healthcare spending as a proxy for how ill a patient is, and as we know, due to long-standing issues of access and to the medical system, gaps in, housing, socioeconomic status, all of these things that have been sort of created from as a result of, long-standing historical racism. Black patients don't necessarily spend as much money in the healthcare system, even when they're much sicker. And so the problem was that the algorithm that was already deployed actually was making everything worse by assigning resources inequitably. So that's one of the starkest, and I would say it's a stark and disturbing example um, of something that was actually already in deployment. We have also done work, particularly for dermatology. In 2022, we looked at AI algorithms that were published on back then. None of these were clinically deployed, but they were, touted in research studies, and people were talking about like eventual clinical deployment. We looked at how well the algorithms did at identifying skin cancer on white versus black skin, and found that the algorithms performed significantly worse on skin cancer on brown and black skin.
Wow. Um, Thank you so much. And what we've heard about AI is, thankfully there are some research and some work out there that's being published. What we know about AI is that it's only as good as the data it's trained on. And knowing that skin of color are underrepresented in training, and then the data sets also impact the accuracy and reliability of these tools. How do you think we can, as dermatologists, how do you think um, we can help train AI, or is there any way we can help to overcome some of these barriers and some of these challenges? What can we do as practicing dermatologists?
Well, I think that this is a multi-layered sort of complex issue, because the first thing we have to fix is sort of the the field itself to start. Like, take AI out of it, because basically, as many people have shown, many of them luminaries within the Skin of Color Society, um, the textbooks are not representative of skin disease. The educational materials, um, at the American Academy of Dermatology has been shown to historically not be reflective of all, skin tone. So there's been a call that we need to like fix the training of human dermatologists. And the reason I also think this is relevant is because the data that's then used to train the AI models comes from humans, right? So in our study, we did show that if you took an algorithm and trained it further on diverse data, it actually improved its performance across diverse data, and had more equitable performance. Um, but I think there's still a caveat to that, because I also worry, like, skin cancers on brown and black skin are not usually discovered to a more late stage, which means we don't actually have image data of more early stage skin cancers in patients with skin of color. And that's an issue, because essentially, because the humans are not catching it at early stage, we don't have images. And so the AI is really being trained more off of the later stage images. So I think that there's that, structural thing where AI is not a band-aid for a problem that is actually a human problem that we need to address.
Wow, very interesting. So you mentioned that, we should take AI out of it. Now more and more fields, including medicine, are relying or finding ways to incorporate AI more and more into clinical care or even into research. How do you propose, or what are some of the ways that you think that in dermatology, we can take a pause and just, and realize where some of the shortcomings of AI are, and then just, wait to either reincorporate AI till it's like trained on diverse populations, or just take it away altogether in dermatological care. Maybe using it in non-clinical avenues, but I worry if removing it from non-clinical avenues, it will still find a way to like trickle itself into into clinical avenues. What are your thoughts on that?
Well, I think it's also again complicated, like because we are now entering an era where people are using AI scribes. I think language models have permeated much more than vision models. Um, I think vision models will end up coming into play. Um, for example, lesion-based like dermoscopy models. What I would really like to see is sort of more benchmarking of these models across skin tones, or at least like an awareness of, the issues amongst model developers so that they can integrate, they can actually address it and, collect data and try to actually build a model that's sort of more equitable. Um, to be honest, like I think there's the like ideal world that I would like and versus the world that we live in today where a lot of things are just happening uh regardless. I mean, I think a lot of people are using AI daily. Um so there's no FDA cleared computer vision algorithms in dermatology right now. All the algorithms that have clearance actually use like spectroscopy, but those studies also were not across diverse skin tones. And the FDA had told the company that they need to provide more data of how their device does across skin tones. I think this is just a very complex. I like the easy answer would be like take AI out of it, but I think the issue is that we are not always the decision makers of what happens within the healthcare system. Um, so it's it there's layers of complexity there to that.
Thank you very much for for just being graciously explaining some of the shortcomings with AI and its data sets currently and its representation across like diverse skin tone. Just, shifting a little bit to teledermatology and access. Teledermatology has expanded access in many ways, but also raises new questions. How has teledermatology changed access to care for patients with skin of color, and where do gaps still remain that you
Yeah,
think?
you know, I I think so. First, I will caveat it to say I have done less research personally in this space. However, I think that there's a couple things I want to bring up. One, I think it's great that teledermatology is available. Um, and I do think that it's expanded access for people who may not be able to drive as far, like have mobility issues. Um, at the same time, not everybody has stable internet. Not everybody has, I mean, we are making the assumption that everybody has smartphones that can take photos. Like I think that these are big assumptions. There are still like language barriers that may exist for people who, don't speak English. And trying to do those visits with an interpreter is I think it's hard. Um And so there might be difficulty around that. I also think that there's the issue that Dr. Jenna Lester has really written about around camera technology and skin tone. So, like, camera technology historically has not been built to accurately capture things on brown and black skin. Like, the original pre-digital color balancing was done off of white models, which were called Shirley cards. And even as things have moved to the digital sphere, there are differences in how that color balancing is done. And the reason I bring that up is because a lot of teledermatology is sort of, store and forward. So you have to take an image. You have to take a good image. But if your camera is not as good at capturing things on your skin tone, then there could be inequity there, um, in how disease is captured for that teledermatology visit.
Wow. It's wonderful your work in this space. And I know that you mentioned that you haven't done a lot of studies in teledermatology, but it's interesting that you bring up, the camera technology and, the ability to like capture in real time pictures, especially in diverse skin population and the limitations that arise from just even from the camera technology. So it seems like we have a long way to go. We have a long way to go just in general as far as providing care and for access to patients of diverse backgrounds and skin of color. So with the issues and with the issues relying with the issues surrounding AI and even dermatology and their heavy reliance on visual assessment and are there any positives at all, that you see with at the intersection of dermatology and with AI and some of the things that we as clinicians, especially for people that care for skin of color, people that have and care for patients of skin of color, are there any things that we should be doing, looking at, just to again try to minimize these gaps that are historically being present for eons before, for eons.
Yeah, I think, you know, again, I think there's like what I think is the ideal versus like what is reality. Um, and I'm not trying to say that reality shouldn't change. I want it to change very much. But I'm trying to think like what are concrete other than just me saying this is bad, that's bad. Like what are the actual concrete things that we could do? I think there has been a push by tech companies because of uproar around this to try to make their cameras better capture, diverse skin tones. I think like being very vocal about this is really important, being in the room. I mean, to me, like we need to diversify all the fields because we need people in the room who recognize when they're not being represented in the algorithm or in the data, right? So I think um, programs that try to improve who is in what perspectives are in the room of in the house of medicine and the development of technology is incredibly important. Like that's something that I think will help change the tide at baseline. And I know it's something that Skin of Color Society has been very dedicated to throughout its existence. So that is like probably foundational work to start. I think pushing for the diversification of data sets is important. I think the other thing to recognize is that lots of people are turning to chatbots online to ask questions about their medical conditions. And so, as scientists and researchers, we need to study and point out when there are deficiencies in those chatbots' behaviors for diseases that impact patients with skin of color. Um, because sometimes those tech companies actually do respond to that. We had done previous work showing some really racist behavior in chatbots when asked particular medical questions. Um, and that was back, oh gosh, now I can't remember what year we published that. But I recently checked and like that some of that behavior had been fixed. And when we wrote our paper, it got a lot of attention in the media. So a lot of, I heard from tech executives that they had read the paper and knew about the issues. So I think continuing to be vocal and to test these things, to test for equity and fairness across algorithms. What I would really love it for it not to be like a post hoc thing. I would love, these developers to think about this when they're building it and not just after we test it and find all the problems. But again, I think that goes back to who's in the room when this technology is being developed. So we can push on both fronts.
Fantastic. And just thank you so much. Those are so many pointers, so many like concrete things that we can request for and advocate for from our end. And hopefully the research, the technology companies and the developers are listening and so they're listening to the cry of the people and also of the clinician and just to improve their data sets and their programs. Are there any particular programs or even cameras or systems that you know are better than others in the on the current market?
Yeah, that's an excellent question. And I have to be completely honest. I have heard claims about which cameras say they're better, but I haven't actually empirically tested it, so I don't want to make claims without actual like empirical testing.
Okay. Are you okay sharing so that some of us can go test it out on our own?
I mean, I think
And
from
if
what
you're
I've
not
heard,
comfortable,
I would say that both Apple and Google, I think, have been trying to make pushes in this
okay,
direction.
okay.
Who is actually better? I don't feel comfortable saying, but I've talked to research teams at both who were trying to make things better.
Thank you very much. Well, I think it's hard. We don't want to step we don't want to step on toes of anyone or get on the bad side of any of those big companies. But
Oh, I don't mind getting on the bad side. I mean, when Google first published the first Derm algorithm, I had no problem pointing out that their first Derm algorithm, that their algorithm had like a very small handful of Fitzpatrick 5 and 6 skin. So I don't mind getting on their bad side. I just don't. I know that both of them are trying, and I just don't have the data to like make a claim. But
okay.
yeah,
No, we appreciate them trying, and
yeah,
thank you also for always advocating in your ways.
yeah.
Thank you very much. And so moving on to, we mentioned all these issues and some of these issues and past issues that, that have been a source of distrust of the medical society. Technology, the presence or the absence or the either incorporation of technology can definitely influence how patients perceive care. How do you think patients respond to the use of AI or teledermatology? And, are there any other unique considerations, trust considerations among patients with skin of color that you've come to realize or you've come to appreciate from your day-to-day work?
I mean, I think consent is really important if you're using AI in someone's care. Believe very strongly that they should be made aware and have the ability to decline the use of AI, particularly for patients with skin of color who may be aware that that AI algorithm might not work as well for them. And so, I mean, like I said, we don't have image-based AI in clinic, but there's ambient scribes. People are using AI to draft like responses and patient messages. And I think it just needs to be really clear where and how AI is being used in clinical care to patients and to get their consent.
Thank you so much. Thank you. So for the consent, just specifically mention, the use of, AI, whether the consent to, because I think most of us have general consents in the in our clinics, but thank you for that practical for that practical tip to include specifically AI in our consents. Sorry, at Stanford, have you guys incorporated AI scribe into your day-to-day clinical practice?
So Stanford has an AI scribe and I do not use it.
Okay, okay. Do you mind me asking why you don't use it?
Well, I have a couple different reasons. One, I don't think that most of these scribes work as well in with the dermatology terms. The second reason is privacy concerns because the encounters are recorded and
Mhm.
kept for some period of time. Um, and the third reason is they do hallucinate, and so you have to be very careful. Like they hallucinate in way, I mean, human scribes also write things that are wrong, but they don't like hallucinate like an entire pregnancy for a patient who wasn't pregnant. Like the hallucinations can be quite um wild at times. I've seen some examples. So I think those are three of the reasons. And then I guess the fourth reason is I have a scribe who helps put together like the history of present illness, but when I write up the assessment and plan, it's actually part of my thinking process. And so I don't want to like cede that thinking process uh to like just like having this AI note and then like not sitting and like thinking through. Because as you know, we don't have a ton of time with each patient, unfortunately.
Yeah. Oh, wow. Interesting. No, we're still looking to incorporate, we haven't incorporated in my practice, we haven't incorporated AI in any way, shape, or form. We're still looking at ways to incorporate it. And every day we feel like we're behind other practices and not even just other practices behind in medicine for not incorporating it. So it's great to listen to you and hear what some of the shortcomings are and some other ways that we as skin of color society and patients, I'm sorry, and providers for skin of color society can advocate for and ensure that policies are being made that that recognize the shortcomings in this technology. Um, so this was great. I learned so much. I didn't really know much about, AI in medicine in dermatology going into this and all the different studies that are out there. Anything else that we should be thinking about that I didn't ask you about, Dr. Daneshjou, with
Oh
regards to
God.
AI, dermatology, and next steps for
I mean,
us?
I think my spicy take is that unfortunately, the way this development is going is that there are going to be sort of systems and practices that replace, physicians with like physician extenders plus AI. I actually think that's where it's going, not because I want it to go there, but
Mhm.
because unfortunately that's sort of from the business of healthcare perspective where it's going to go. But I think the area which that will be the least successful is actually caring for skin of color because AI is actually so bad at that. And so interestingly, if there is like AI related job loss, I think physicians who specialize in treating skin of color will not have that job loss as much.
Well, it's positive, always great to hear positive things about job security for the future for those of us that care for skin of color patients. You know, wanted to just get your thoughts on the use of AI or any other like tools, for hair loss, because hair loss is one of the main, one of the main, actually not one of the main, one of the many, but predominant issues that we see in skin of color society. anything out there at all for, for hair loss, whether it's in
Yeah.
diagnosing.
I mean, I had an amazing student actually. Um, her name is Paz,
Mhm,
and she came to work with me from Mahari, and she did a review of AI tools for like on hair, and found essential like looking to see if there was a bias
mhm,
with like, textured versus untextured hair. And she found that actually the AI literature on hair is like very sparse. And
mhm.
of course, there's like a severe underrepresentation of tools around textured hair. So I think this could be an opportunity to try to, create something that works, for especially being able to like monitor
Yeah,
progress of treatment.
yeah. Wow, that's I was hopeful. I was hopeful for that. Um, so any other closing reflections, anything else, Dr. Daneshjou?
Thank you so much for having me.
No, this was great. Thank you so much for sharing your insights for this important discussion. I think it's great for all of us to know that AI is not quite ready when it comes to the skin of color diverse for the skin of color diverse populations. There's a lot that needs to be done from the technology perspective and also from the data set that's it's been fed. And again, that circles back to training, to the training in dermatology and just how there needs to be more emphasis or on skin of color and then just improving the education on skin of color. So more work needs to be done. And thanks for bringing all those pointers to the Skin of Color Society, because as leaders in skin of color dermatology, I think it's just more work and things we need to add to our advocacy and also to our agenda. And I just want to thank you to our listeners. We hope that this Savvy Conversation episode encourages you to think critically about how technology is shaping dermatologic care and how we can ensure it advances equity rather than widen existing gaps. To learn more about the Skin of Color Society and its initiatives, please visit skinofcolorsociety.org and be sure to follow the Skin of Color Savvy for future conversations centered on advancing equitable dermatologic care. Thank you so much for listening, and thank you so much, Dr. Daneshjou, for your time. Appreciate it. Thank
Thank
you.
you.